graph below to answer the following question. What can we determine about the pointed finger with no? Graphing questions. Graphing questions on the exam are going to look similar to this, and this is straight from the Cooper book, okay? So they're gonna look like this, and they're going to be a little complex at first glance. What you wanna do is identify different parts and what you're looking at. In this case, we know we're looking at number of bytes and pinches per days. We have days as our time. We have a baseline session. We have a pointed finger session, a baseline session, and a pointed finger session. So what does this look like to me? Well, it looks like to me a withdrawal design, right? We're going A, B, A, B. Question wants to know, what can we determine about the pointed finger with no? If we look at our graph, the pointed finger with no is our intervention, right? We have baseline. Our number of bytes and pinches per day is quite high. We then introduce the what? The pointed finger with no, and what happens? Well, our number of bytes plummets. We reverse it. Our number of bytes increases slightly. We reverse it again. And what happens? Bytes go down again, right? So what can we determine about this pointed finger with no? Would you say the pointed finger with no is reinforcing? Of course not, right? Because when we implement the pointed finger with no, what happens to the behavior? Well, it decreases. Can you say the pointed finger with no is punishing? You actually can. And why is that? Well, because we reversed this design, right? We withdrew the treatment. You can say the pointed finger with no is punishing. We can say we have functional control. Had we stopped at baseline 2 and we don't have intervention phase 2, you couldn't definitively say we have any functional control. But because we've withdrawn it and then reversed it, right? You can definitively say we have some sort of functional control over the behavior. So B is going to be our answer. C, the pointed finger with no had no effect. Obviously not true. And then D, we cannot determine the effect. Again, if we had not reversed it, our answer would be D, but we did, so we can determine that we have functional control or experimental control. Therefore, we can determine the pointed finger with no was punishing, because when we introduce the pointed finger, what happens to behavior? It decreases. Which of the following basic schedules routinely produces a scallop effect? You've probably seen this question 100 times if you've been studying, if you've been reviewing. It's a very common question because it is something you need to know about basic schedules. So very simply, right, on these type of questions, it's just something you need to know. Now, you can think through it because it makes sense fundamentally if we think about it, okay? Because a scallop, we are looking at sort of a curved upwards effect. And the reason that's occurring is because after reinforcement is delivered, there's a post-reinforcement pause. So our line, you could say, is flat. And then responding starts to increase. So we start to develop a scallop curved effect. So what basic schedule routinely produces that? It's going to be fixed interval, okay? And we're not going to review the other three because this is one of the few, I would say, rote questions you need to know, okay? What produces a post-reinforcement pause and a scallop effect? It's going to be a fixed interval. Again, think through it, right? Think through why it happens, and it makes sense, okay? Nothing else, though. Just know this. FI, scallop effect. Evocative effects impact what aspect of behavior? Think about what an evocative effect is. An evocative effect has to do with motivating operations, closely tied to establishing operations. Establishing operations do what? They establish a consequence, or they increase the value of a consequence. And by increasing the value of a consequence, you can expect to see more behavior to reach that consequence. Thus, an evocative effect is an increase in behavior, but what type of behavior? Are we looking at duration with evocative effects? No, okay? We are increasing behavior, but evocative effects don't necessarily have any impact on current or future duration, so we can eliminate A and B. That leaves us with C and D, current and future frequency. Now, what do we know about consequences? What do we know about reinforcement and punishment? We know reinforcement and punishment impact future behavior. Evocative and abative effects impact current behavior. So evocative effects actually impact current frequency of behavior. If this doesn't make sense, go back and review your motivating operations. Motivating operations are one of the things that give people the most trouble. Once you review it and once you understand it fundamentally, it becomes very simple. We don't want to miss questions about motivating operations SDs, reinforcers, punishers. These are the fundamentals, okay? Make sure you have this stuff down. Additionally, all of these fundamentals build into the harder material, okay? So again, evocative effects, which are motivating operations, which are antecedents, impact current frequency. Consequences, right, impact future. All right. Evaluate the following behavior targets. Which one should be prioritized in a treatment plan? Behavior targets, behavior goals, treatment plan goals. What are we thinking when we see questions like this? Remember, we're supposed to be evaluating the question, not just jumping to the answer choices and hoping one jumps out. Think about the question. So what comes to mind? To me, I'm thinking socially valid. I'm thinking pivotal behaviors. I'm thinking behavior cusps. What behaviors are going to, one, be meaningful, two, introduce my client to other reinforcement and affect other behaviors, right? And three, what are most important? So let's look. We have a client raising their hand in class, a client imitating a peer model, a client cleaning up after they are done playing or eating, and then a client brushing their teeth independently. So in my opinion, the least important would be raising their hand in class. Okay, maybe you want them to participate, but do all kids raise their hand in class? Not really. Is it essential? Is it important? Depends, right? Not really. Compared to the other ones, it's probably the least important. Now, what about cleaning up after they are done playing or eating? Well, okay, if you are in a public setting or in a cafeteria setting in real life, you do need to clean up after yourself a lot of times. So C is a little better. But is C as important as brushing their teeth independently or imitating a peer model? Not necessarily. Brushing teeth is directly related to health, right? So health is one of the most important, if not the most important things. The thing here, though, it says independently, right? So that implies we can still help the client brush their teeth, okay? But imitating a peer model, think about this in terms of a pivotal behavior and a behavior cusp. Think about imitating a peer model and how that helps raising their hand in class, how that helps cleaning up after they're done playing or eating. Think about if we can teach imitation, the client can now watch other kids raise their hands and start doing it. They can watch other kids clean up and start doing it. Imitation opens up the world, right? It allows the client to not only modify other behaviors, it leads to contacting more reinforcement. Imitating a peer model, imitation in general, is going to have a much larger effect than A, C, or D. And that's what we're looking for with these behavior target behavior goals, okay? Important, meaningful, socially valid, right? Safety, all those things, behavior cusp, pivotal behaviors, all those things we have to consider when choosing behavior targets, especially on the exam when we are really using an imaginary kid, right? That's really what they're testing. All right, our answer here is B. Grayson started headbanging 2 months ago. Grayson's stakeholders started delivering M&Ms and praise when Grayson was not engaging in headbanging. So far, they have seen headbanging decrease. If a BCBA wanted to analyze each part of the treatment, which of the following would be least recommended? A lot going on here. A little complicated. Let's think about the question. A great strategy, I always say, cover the answer choices and just look at the question. So what do they want to know? It wants to know, the BCBA wants to analyze each part of this treatment. Which of the following would be least recommended? So whenever you see something like, well, we're going to analyze parts of the treatment, what are you thinking? You should be thinking component analysis, parametric analysis, and things like comparative analysis, right? We're taking parts of treatment, okay? In this case, what happened? Well, Grayson was headbanging, so self-injury. He's no longer headbanging, right? They've seen a lot of headbanging decrease. What in your mind would you not do here, right? If we have a self-injurious behavior, we've started to see a decrease, what is the last thing we want to do? Think about ethics, think about what it says about evaluating treatment and how we should do that. Well, I would not want to reverse this, right? It's the last thing I would want to do, okay? If we see positive decreases, a significant decrease, we should say, in a self-injurious behavior, the last thing we want to do is reverse whatever we're doing. So that's what we're thinking going to the answer choices. So as you see, we have an alternating treatment design, withdrawal design, parametric analysis, and component analysis. Now, regardless of how we feel about alternating treatment designs, parametric analyses, and component analyses, as it relates to this, the last thing we want to do is what? Withdraw. Remember, we're looking for the best answer. So once you see withdrawal, boom, we should pick that. Okay, we should know that's our answer. Now, we want to evaluate the other ones. Absolutely. We always want to read all of our answer choices, okay? But we're not concerned really about how these are going to help us meet our goal. We're more concerned about which one we are definitely not using, and that's going to be withdrawal design. Okay, self-injury, seeing a decrease, don't withdraw it. Why? We risk reversing the behavior and watching it increase again. Gordon Ramsay just created a new dish for his restaurant. He prepares 4 different versions of the dish, each with different amounts of salt. He then serves them to his staff one at a time and asks which one they like best. What type of procedure does this most closely represent? Cover up the answer choices and think about it. What do we have? We have a dish. We have 4 different versions of the dish, each with different amounts of salt. So what does that say to you? We're using a different amount of salt, right? We have one variable here, right? A single stimulus in different amounts. What procedure do we use to analyze how much of an IV or dosage of an IV? Well, we use a parametric analysis, right? If we know Tylenol gets rid of our headache, and we want to know if we want to use 1, 2, or 3 Tylenol, what are we using? Parametric analysis, right? If we know a reinforcement of using praise, okay, is effective, and we want to know if we should praise once, twice, or 3 times, we're using a parametric analysis. Same thing here, right? We have dishes. We were using different amounts of salt, maybe 1 teaspoon, 2 teaspoons, or 3 teaspoons of salt. We're using a parametric analysis, right? And if we look at A, that's our answer. It's not a component analysis because we don't have different components. It's a single component of salt. Again, not a comparative analysis because we only have a single instance or a single stimulus or a single variable, right? And then it's not a multiple stimulus preference assessment because what is the key? It says he serves them each dish one at a time. So we're not presenting all the dishes, just one at a time. The answer here is going to be A, parametric analysis. Do these breakdowns when you're studying, okay? It's going to get you better at the exam. When teaching MANs to a client who loves Paw Patrol, which of the following strategies would you consider first? If you encounter verbal operant training questions on the exam, first thing we need to think of, what evokes the verbal operant? How do we reinforce the verbal operant? That's what they're testing you on, okay? So what evokes a MAND? Well, an MO, okay, motivating operation. So we're trying to avoid as much as we can instances where we're using verbal SDs, right, to evoke something about Paw Patrol. So A, place a Paw Patrol stuffed animal where the client can see it and say, what is that? Now, this would not be a MAND, right? If anything, if they answer you, this would technically be an interverbal, but I could see how you would use this for TAC training as well. You would not use this for MAND training though, okay? B, whenever your client is watching Paw Patrol, ask your client, who is your favorite character? Now, this would certainly be some sort of interverbal training, okay? Who is your favorite character? What is that? Both verbal SDs, okay? Both leading to interverbals, right? C, praise the client when they say Paw Patrol unprompted. Or D, provide the client with the Paw Patrol stuffed animal when they say Paw Patrol unprompted. Now, what's the difference here? Remember what we said at the beginning. Not only do we need to know what evokes it, but what also reinforces it. So in C, what are we using to reinforce? A GCR, praise. D, what are we using to reinforce? Well, the Paw Patrol stuffed animal. A MAND, how do we reinforce? With whatever they ask for. D is the best. They're saying Paw Patrol unprompted. We're giving them what they asked for. D is the best type of MAND training out of these 4. What dimensional quantity of behavior refers to the idea that every instance of behavior occurs at a point in time? What are the 3 dimensional quantities? Temporal extent, temporal locus, and repeatability. These are where our measurement procedures are derived from. Temporal extent relates to duration. Temporal locus relates to IRT and latency. Repeatability, where it relates to things like count, frequency, rate. Okay. So which one of them refers to the idea that behavior occurs at a point in time? Well, temporal extent we know is duration, so it's looking at a length, right? We're not really worried about the whole point in time relative to other things. We're worried about that single instance and how long it's lasting. Temporal locus, however, right, we are worried about the point in time relative to other things. Think about latency. SD to a response. Point in time, relative. Think about IRT, response to response. Point in time, relative. Our answer here is going to be temporal locus. Repeatability is simply happening over and over again. While running a 5K, Jamie tells herself, "You can do this, you're almost there." What does this represent? Okay, careful. Self-management question. People struggle with self-management. People struggle with management in general. If Jamie is telling herself, "You can do this, you're almost there," it is definitely not an interverbal. All right. There's no speaker, right? There's no other speaker. There's nobody around her. It's automatic. Not no coic, same reason, right? Nobody to talk to, nobody to echo, nobody to use an interverbal with. So we're looking at self-evaluation and self-instruction. Well, what is self-evaluation? Self-evaluation, taking your performance and comparing it to a goal or a criterion. Is Jamie comparing herself to anything? No. What is she doing? She's using verbal behavior, okay, as a response prompt, right? Keep going. You can do this. You're almost there. This is self-instruction, okay? Management, self-management, self-control. Don't get these mixed up. Self-evaluation, self-instruction, these type of things, okay? They're each individual, right? Understand that self-evaluation is comparing. Self-instruction is an actual verbal, right, rule prompting your own responses. Okay, thanks for watching. Please like